Hi, this is Christina with Questions for a Nurse, and again, I'm reading funny nursing clinical stories on Reddit. This one said, while getting bedside report from the nurses, the patient asked us to adjust her STDs. These are little leg things. As I was adjusting her, the room was dark. I felt something dripping on my shoes. I couldn't see the culprit until I turned on the lights, and I realized that her Foley bag was about to burst, and somebody hadn't clamped it appropriately, so it was leaking a little bit. Thankfully, they were able to put everything back together and clear the Foley. But the instructor, when they saw how wet her foot was, her shoe, they were calling it pea foot. I have never heard this term, but that's what they called it. She said that's a pea foot. And they said she had to take off her shoe, wash her sock, put on a pair of patient's socks, and put a glove in there to protect her foot from that point forward, not getting wet from the shoes. Gosh, I mean, so I don't know what I would do in that situation. I've had yucky things on my shoes, but I've never had it actually saturate a shoe. But I don't wear tennis shoes either. I don't wear any shoes that could saturate. All my shoes are actually rubber, so they don't hold that stuff in. I mean, but wow, to be on the clinical and figure out how to take care of what they're calling a pea foot, that's impressive. I have slipped in pee, but not to the ground. The only time I've ever slipped in anything to do with patients, um, excrements is during a coat, and we all slipped. It was just a mess. So, but good on her. That's a pretty inventive student.